A GOP-led process of repealing Obamacare has begun in Congress, but Democrats have raised questions about how Republicans plan to replace the health care law. Now it appears those questions may have some answers. One America's John Hines has more from Washington.
The repeal of Obamacare has begun, and now the House Republican Study Committee, or RSC, acting on behalf of conservatives in the House, has introduced a replacement for Obamacare, says Committee Chairman Mark Walker.
Our goal in the RSC is to be proactive and fulfill the promises that we have made to the American people. We look forward to working with leadership and this administration in finding the solutions that provide opportunities for all of our communities. This is round one of a 15 scheduled round fight. Basically, as the conservative caucus in the House, our job is to bat leadoff.
And leadoff means laying down a conservative marker called the American Health Care Reform Act of 2017 in what could be a long, noisy discussion about replacing Obamacare. The act starts by repealing Obamacare, which has become expensive, and then provides an affordable alternative, says Texas Congressman Babin.
This is basically a backstop for after the repeal. We're not going to leave anyone high and dry who is already covered. But what we are rolling out is a repeal of a disastrous program that we have been afflicted with for the last 6 years. We are experiencing an average increase of premiums across this country of 25 to 26%. Some states are over 3 digits, 100 and something percent increase.
Increasing premiums is one big problem with Obamacare, of course. And Tennessee Congressman Phil Rowe, who is also a medical doctor, says conservatives tried to keep that in mind with this bill.
How did we come up with this bill? We wanted it patient-centered, where patients and doctors were back in charge of healthcare decisions, not bureaucrats, not insurance companies. So how do we accomplish that? Well, we sat down around the table, and let's look at the principles, the conservative principles that we look at. What do we agree on? And those things are the following. First, we agreed to repeal the Affordable Care Act because it's not working for the American people. Number two, we looked at how do you make health insurance cheaper?
Some ways in which conservatives hope to make health care more affordable is by allowing competition across state lines for insurance and by improving the litigation environment for doctors. These are among some of the cost-saving ideas that were not included in Obamacare. John Hines, One America News, Washington.